Good afternoon. Good afternoon, and welcome to the Budget Subcommittee on Health and Human Services. We apologize for the delay. We have several members who are out and a member who is on paternity leave. We will have members who are coming in and out as they are serving on various committees, but we do have important business to take care of, your business, the people's business, and we look forward to the conversation. We're addressing really important issues today, and we want to hear from everyone. And in that respect, we're asking that everyone who presents today just be brief so that we can focus on the questions and discussion from the public. As always, we ask our presenters, we welcome you. We ask our presenters if you could just give us the high-level overview, 3 to 5 minutes and just a quick overview, so there'll be time for questions from members or member, as the case might be. In the public, we ask that we will have public comment on all of our issues, but we typically ask members to speak for 1 minute so that we can ensure that we have heard from everyone. This has been a historic week. As many of you know, in the world of Health and Human Services, just last week, this legislature approved a MCO tax, a tax on managed care organizations to provide funding for Medi-Cal at a level of about $1 billion. Also record-setting that this legislature, and supported by our governor, provided $300 million to support individuals who have a developmental disability. And it was great to be able to provide that funding to support these important communities. We know that we're not done, and there are very important issues to discuss related to the in-home supportive services program, related to SSI and SSP, and we look forward to having a rigorous discussion on those issues today, and we welcome your participation. With that, we're going to dispense with the roll and get right into the conversation. We'll be joined by members as they come forward. We want to move right into the first issue, the Supplemental Security Income and State Supplementary Payment Budget and Program Review, as well as a proposal from the advocates. We welcome Director Lightbourne and Eileen Carroll from the California Department of Social Services. We have representatives from Finance, and we'll hear from Californians for SSI. And we're honored to have someone who will be speaking and providing direct testimony about the SSI program, and of course the LAO's office. Welcome, and with that, we'd like to begin. Thank you.
Thank you, Chair Thurman. As you mentioned, I'm joined by Eileen Carroll and Pete Chervinka from the department. As you requested, we'll be very, very brief. The SSI-SSP portion of the budget, which is your first item, the estimated budget for fiscal year 2016-2017 is $9.8 billion. $2.5 billion of that is the SSP portion, and it includes the SSP Necessities Index COLA for 2017. Thank you.
Will others from your team be presenting, sir?
No, I think unless there are questions, we're...
Thank you. Anything from the Department of Finance?
No.
Thank you. Anything from the LAO's office?
Yes, Mr. Chair. Good afternoon. Callie Freetag with the Legislative Analyst's Office. The governor's proposed cost of living adjustment would adjust the SSP portion of the grant, which is the state-funded portion of the SSI-SSP grant, by the California Necessities Index. If you turn to the table on page 7 of your agenda, the agenda lays out the cost of the governor's January proposal as the governor had estimated it in January. We would note that we estimate the cost of the governor's budget proposal to be slightly lower than what's listed in your agenda, based on revisions to the aforementioned California Necessities Index, based on data that came out afterwards. We would also note, on a broader policy level, that the subcommittee has asked us to prepare cost estimates for what it would take to raise the SSI SSP grant to the federal poverty level over the course of 5 years. This is in keeping with our analysis of the governor's budget proposal, which suggested that the legislature consider their overall goals for the SSI SSP grant levels as they think about whether or how to raise the SSI SSP grant. We worked with the department to provide these estimates, and how it works out to get that SSI SSP grant to federal poverty level over 5 years would require about a $20 per year increase to the maximum monthly grant for individuals every year for the next 5 years. And so we estimate that this would incrementally cost about $270 million to $280 million per year for those next 5 years, all accumulating to a $1.4 billion cost in 2021. Now, this is one option for considering grant increases to SSI SSP, and we'll continue to work with your staff and the department as you may consider options for these grants.
Thank you. This committee heard very strong testimony last year about the need for an increase in SSI and SSP. We heard from Californians who sadly have to make decisions about after they pay their rent, they barely have enough money for food, or they have to make choices between eating and paying for their medication. And we don't think that this is a place that we should put Californians. So, Mr. Lightbourne, we're certainly on record in indicating that we want to see all that can be done to assist our Californians who depend on SSI and SSP and are trying to really live in these high-cost times that we are experiencing in California. So we appreciate your efforts going forward and those of the department and the administration. We're honored. Is Mr. Faber here today?
Yes, sir.
Hi. We are honored to have you here, and we look forward to your testimony, sir.
Assemblymember Thurman, I'm Mike Carroll with the Western Center on Law and Poverty. I appreciate you giving us the opportunity to speak, and I'm going to give almost all of my time to Mr. Faber. I did just want to acknowledge two things. One is we sincerely appreciate the efforts of this subcommittee the past 2 years in supporting increases to the SSP portion of the grant. We really believe that the support of this subcommittee has been instrumental in the movement by the governor's office this year to actually propose a modest increase at the SSP amount. And we want to acknowledge that the governor did do that in the budget, and we think it's a very important step, and we hope that that will actually lead to the first increase that we would see to the SSP grant after all of the cuts that we made over the several years of great difficulty that we went through. So we are looking hopeful that we can do something like the LAO has just proposed, as we've seen in legislation proposed in this building this year, to gradually but surely get the SSI grant back above the poverty level. And now I will relinquish the rest of my time to Mr. Faber, Anthony Faber from San Francisco, to discuss why he is in favor of this increase.
It's a no-brainer. I get $889.40 every month, and I have to write a check to my landlord for $863.96. That leaves me $25.44 for everything else. I mean, I don't know about choosing between food and whatever. You know, luckily I get food from food pantries, and if that runs out, I can go to St. Anthony's and get lunch and stuff, you know. So, you know, I don't have to worry about food. And for entertainment, I mean, I read. But, you know, essentially, I just have no money. And since I have no money, I just don't spend anything. And it would be really nice just to have a little cushion. Because, you know, if anything happens, I have to, you know, I do have relatives who have money, and I can go to them hat in hand and say, oh, could you please? But, you know, I don't want to do that. And, you know, I'd like to be self-sufficient. And that's about it. Thank you.
Thank you, Ms. Faber. Everything that you've said is reasonable, and we have responsibility to do better. It's as simple as that. And I want to thank you for sharing, and you know, please continue to share with us ways that you think that the state can be helpful. I appreciate you. Thank you so much. Thank you. Wanted to, if there was any further reaction from the department, from the LEO or finance, I'd like to hear from the public on this issue. Is there any public comment on this issue?
Good afternoon, Chairman Thurman, members. Gary Passmore with the Congress of California Seniors. I want to make sure while you're on this topic that we remind ourselves that there is a major financial issue within the SSI SSP conversation, and that has to do with the cash out program. I'm not going to take your time to go through all of that. I'm sure you're very familiar with it. My request would be that as you, over the next year or 6 months or several years, develop some kind of a review process of how to get to this 100% of federal poverty level minimum for SSI, that you also look at that program and be as creative as you can to consider ways that the state can take better advantage of federal dollars and increase the support that's available for people. So just to make the note, please keep that in your conversations as you work through this proposal. Thanks.
Thank you. Again, this committee has been extremely supportive of the issues of increasing California's share of SSP, and we will continue to be. And I can't underscore how important it is that we do this. We want to hear from everybody, so I'm going to ask speakers, if you would, again, work within 1 minute. We want to hear the emphasis that you wish to add. We thank you and welcome you. Thank you.
Michelle Rousey. As you know, these times are really hard, and living on a low income is almost impossible these days. I want to have you, when you take your walk today, when you go out to your car today, I want you to look around our communities. There's a lot of homeless people, whether they're disabled, seniors. They're out on the street because they have nowhere to go. Our housing situation is extremely harsh in California, and I'm wondering, if we raise this, will it help? I hope so. But there's a larger issue than just our grants and our level of income that we get. That we need to look at all the different levels of that are affected for people with disabilities and our seniors, so that they have an overall well-being in California. Thank you.
Thank you.
Thank you. My name is Connie Arnold. Thank you for allowing public comment here. I myself am not on SSI, but I have plenty of friends and people that are struggling on SSI. SSI was supposed to cover food, clothing, and shelter. It has not really ever really fully covered food, clothing, and shelter. I remember when I was on an SSI back in, I think it was 82, I think the payment back then was around $603. Then I think at some point it went up probably many years later to $620. We're now at $889.40 for an individual with a disability living with cooking facilities. People can't afford finding housing. Quadriplegics are moving from the hospital to nursing homes. There's a lack of support not only in SSI payments but in low-income accessible housing for people. And these are all the issues that have to be addressed. A $17 raise increase is certainly insufficient. I haven't looked at the current proposal, but you've got to start raising it up to have the cost of living be enough to cover things that SSI was supposed to cover for individuals. I did pass out a handout of some bullet points that I wrote, and I do want to say, that people on SSI are not allowed to participate in the SNAP program, which is the former food stamp program. People whose incomes are much higher than SSI are eligible to participate in SNAP. But by virtue of being on SSI, individuals are excluded from the SNAP program. I think you need to revisit that issue or make sure that you're including enough in the payment to cover what food expenses are today, as well as shelter. Shelter's not just rent. Shelter includes a lot of other issues. So please address this issue and make sure people can afford to live in the community. Thank you.
Thank you. I'm going to have to take a recess at some point because I have to check in. So I'm going to take a short recess.
I live in the Bay Area. The Bay Area has the highest inflation rate in the United States. Last year it was, I believe, 2.3%. There was no increase in COLA, either for SSI or Social Security. 2/3 of my income goes to my rent. I've had to pay an increase in my rent cost without getting any increase in these other programs. I can barely scrape by. I really can't. I have to go to food banks, and I would deeply appreciate it if you'd consider the increase to meet the national poverty level. I think that would be appropriate.
Thank you.
Andrew Shane from the California Association of Food Banks, and also a member of the district. Thank you, Mr. Chair. Very briefly, to put a statewide perspective on this, I know we're hearing a lot of folks speak to the reliance on the Emergency Food Network. I would just say that we've seen approximately a doubling of the seniors and folks on the program in the food banks and the pantry network. This is simply unsustainable. We are literally helping keep folks surviving, fed, nourished on a month-to-month basis because the grants are never enough. I would also encourage, as the committee, finance, the LAO continue to explore, we realize that these do present fiscal challenges, but there's tremendous savings when we nurture a healthy population. We know that hospitalizations spike the fourth week of the month when low-income folks' budgets simply run out, and that healthcare utilization is a tremendous strain as well. So let's be thinking about the opportunities that this investment creates, not just for our people, but for our state as well. Thank you.
Thank you.
Mr. Chair, member of the committee, my name is Chris Jensen. I work for Resources for Independent Living here in Sacramento, providing resources and services to people with disabilities. But we like to say that our office is located at the intersection of disability and poverty. We see a lot of people on SSI, and housing is a serious, serious issue. They just cannot find affordable housing. And I know that that's an issue in this building this year. But no matter what happens, it's going to be a while before housing gets built. And we've got a crisis now that needs to be addressed, and this is one good way to begin to address that by raising the SSP amount and providing a COLA. And if memory serves me correctly, historically the COLA was calculated on the combined SSI SSP amount. However, the governor's budget only has it calculated on the SSP amount. And honestly, this year the federal government is not supplying a COLA. There's no guarantee they're going to supply a COLA next year. That $17 figure is I think it's just, it is misleading, because actuality, the state portion would only be like a $4 amount increase. So it's minuscule. It's almost embarrassing. So my time is up, and I thank you very much for hearing me.
Thank you. As the next speaker comes, I simply want to acknowledge the presence of our budget chair, who needs no introduction. She is a champion on so many issues, and has in particular been a champion on issues of addressing income inequality. Welcome, Chair, Dr. Weber.
Deborah Doctor, Disability Rights California. Good afternoon, Mr. Chairman and Dr. Weber. I was in Safeway last week, and I didn't see any line like special prices for people on SSI. And so I think, gas prices are down, and that's good, but probably people on SSI can't afford to own a car and run it. 2 points. One is the economic point that the gentleman spoke about earlier when he said he pays almost all his money for rent. He has no other money to spend. People will not use this SSI increase to, increase their investments in real estate. They are going to spend it on goods and services in the community. It comes back to the community. And my last point is, as you both well know, people have the right under the law to live in the most integrated environment, and we cannot continue to have people living in nursing homes or other institutions because it's the only housing they can find with their incomes. Thank you.
Thank you.
Hi, I'm Colleen Rebecca from St. Anthony Foundation, where Anthony eats lunch with us, and happy that we could facilitate him being here today. We serve about 2,500 meals a day at St. Anthony's, and our first hour and a half is the senior hour. We actually had to make our senior hour last longer than an hour because of the great need for seniors and people with disabilities in our community for free meals. I've been doing this work for almost 11 years now, and so I have every year in the budget, for the state budget, I have seen over the years of the recession the grants to SSI being reduced and reduced and reduced and reduced, and now they're at the minimum level that the federal government allows us to be at for the state contribution. So it's the official policy of the state of California for our seniors and people with disabilities to be in poverty because the SSI grants right now are only 90% of the poverty level. That's what we want to change, and we want to see stability for those folks on SSI who are important members of our community too. Thanks.
Thank you.
Good afternoon, Senator. My name is Arthur Hutchison, and I'm 73 years old. And at the age of 62 when I first retired, and I feel that I was going to make it during those years, but what happened to me, I almost went blind. And I had to have eye transplants in my eyes, and it costed me somewhere about $3,000 to $5,000. And when I got the doctor bill, it was halfway. I thought my Medicare would have paid out on me, but I found out I had $2,500 to pay out of that. I still owe that bill. And that was about 10 years, 12, 13 years ago, and I still owe on that bill. I had a liver problem. I had a kidney problem. Then I turned around my heart problem, and I went to the hospital for that, and I ended up with the hospital bill. I thought at age of 62, we're supposed to have been considered disabled. But when I got those hospital bills, I still owe $10,000 out to the hospital. And so, in other words, I only have just a certain amount of the Social Security amount, $1,000. And then I pay out of that my Medicare. So, it'd be nice for the SSI, SSP. Thank you here.
Thank you, sir.
Hi, my name is Anita Poole, and I've been working since I was 16. I first went to work in Oakland at the NYC program. Well, actually 14. I was very happy to work, and I've been very happy to work since. I've been a single mother for most of my life of 3. I've worked at General Motors with men. I built the first eye laser in this country in Palo Alto, working for Monsanto. Actually, I went to Monsanto and then Cooper Medical. And I have not stopped working. But now, and at one point I weighed 367 pounds, I've been in some very bad accidents driving Chevy Impalas, where one man in California was allowed to have a driver's license with a glass eye. And he came out at the last minute. I hit him, and from then I've had a sciatic nerve and problems in my low back. I had a second accident like that, no fault of my own. But I live in pain. I have raised 3 children, and I cannot even get my Social Security benefits. For 3 years, since 2012, and I'm tall, mostly legs. When I sit, it's low. That's a lot of pain on my knees and my low back. Nobody sees that when they look at me. They just say, oh, you look just fine. But the problem is that I have taken care of my children and my elders, and now I can't take care of me. I stay in St. Mary's Shelter in Oakland. So something needs to change about Social Security for the people who believe in hard work and who deserve to get what they deserve and need when it's time.
Thank you, ma'am.
Dennis Hubbard from the Alliance for Retired Americans, the California branch. We certainly need this investment for the increase in SSI and SSP, help people out of poverty and give them the health care they need. Thank you.
Thank you.
Hi, my name is Warren Cushman, and I live in the Bay Area. I get $599 SSI SSP, and our rent is $1,700 a month. So I'm forced to choose between rent and food. I don't eat often as I should, and I cut down on food because I have to pay rent. I'm very concerned that in the past several years about SSI SSP, that it's been going down, or the COLA hasn't been passed on, and I urge the legislature to do what it did last year to pass this bill, and hopefully we can convince the governor to sign it. Thank you.
Thank you.
Good afternoon. My name is Emily Harris, and I'm the field director with the Ella Baker Center for Human Rights. And we're an organization in Oakland working to end mass incarceration and move the resources that have been wasted on locking people up into the social safety net and into programs that will support low-income communities and communities of color. And we have worked closely with our anti-poverty advocates and are in strong support of lots of increases to SSI, and I'm actually here. You can see I'm wearing a No New Jails t-shirt because actually on the other side of the building, room 437, they're actually talking about taking $250 million from the general fund to build new jails. So that's $250 million that you can snag today to go towards this program, and I hope you will consider doing that because I know these decisions are happening in different committees at the same time, but that is detrimental to California, and this is going to save people. So we really hope that you will look into that allocation. Thank you.
Thank you.
Hi, my name's Katie Tertoka. I'm a relatively new resident of California. I moved here after I graduated college up in Washington State. And I can say from my experience that rent was shocking in terms of how expensive it was, around $1,000 at least for a living room or a studio apartment, and I'm having a hard time finding a job. I'm able-bodied, I'm young, I have a college degree, and I don't think that people who are on SSI should have an even harder time finding a place to live or have to live below the poverty level. I find that really disgraceful and really behind the times. And I also want to advocate for adding food stamps for folks to be able to not just have an income above the poverty level, way above the poverty level, but also to be able to have food stamps. I learned that California is the only state where folks on SSI can't have food stamps, and that doesn't make any sense to me. So I'm here with CURB, Californians United for a Responsible Budget, and I also agree with what Emily just said. There's $250 million in the general fund that could be used right now for this. So thank you.
Thank you.
Good afternoon. My name is Secret Peoples. I'm with EPL, which is East Bay Housing Organization. I'm also a member of EBOSI, which is East Bay Asian Local Development Corporation. I'm also an activist in my community. I am 61 years old, and I just don't understand why this is happening. We can all work together. We can't do it by ourselves, but we can all work together. I'm asking you, let us step up to the plate, make a home run, and stop this hunger. I can't go out here and do illegal things because I'm too old. I wouldn't even try to do that. I can't do it because it's not fair. It's not fair to me, it's not fair to y'all, because I'm not trying to go to jail at no 61 years old. So I'm asking you, please, let's all work together. Nothing beats a failure but a try, okay? Please, let's just do this. Let's step up to the plate, get a home run, knock it out the park, and stop this hunger. Again, my name is Secret Peoples. Thank you for your time.
Thank you.
Afternoon. My name is Lisa Scott. I'm from El Dorado County, and I'm an in-home health care worker. I care for 3 seniors. I have been for the last 10 years. Many of our home care clients live on fixed incomes and worry about how they're going to pay their rent, how they're going to buy their food, and pay their bills. I am here today to urge you guys to increase the SSI, SSP benefit grants to help lift many of the California's seniors and people with disability out of poverty. It is our responsibility to do what we can to ease the financial worries of the elderly and people with disabilities. One way we can do this is by reinstating SSI, SSP cost of living adjustments. That the seniors and people with disabilities give them the dignity that they deserve by ensuring they receive fair and equal benefits. Thank you.
Thank you.